just relax and have some fun.
Well, what a great day. Gosh, this is an amazing crowd. This is, give yourselves a round of applause. We're not here by accident. You all know why we're here, which is to sign a bill that I'm going to talk about in a second. But let me just say why we're signing the bill here at Crocs. And I want to thank Laura Hopper. Laura, where are you? We're here for a couple of reasons to sign this bill. The Virginia Beach restaurants really have been leaders on this effort. And, you know, the statewide association went wild about the bill, but the Virginia Beach restaurants were very, very, very strong with us. Last year, when we kind of kicked off the effort, and I guess it might have been December of '07 or January of '08, Matt Falvey, who is here, where's Matt? Matt, we were one of Matt's restaurants, Hot Tuna, and he's played a great role, and then Laura, and so many of you have. And so it's really fitting to come back, and it just so happened to work because so many of the key legislators who really worked to get this kind of over the goal line are right here in Hampton Roads. So you're going to hear from some of them in a minute. Not all the legislators who are here today are going to talk, but let me just kind of go. But let me just do a special thing. I just want to have you know the legislators here with me. Vivian Watts. Vivian is from Northern Virginia. Bob Brink, also from Northern Virginia. Morris, a great delegate from the city of Richmond. I think you know Algie Howe from the city of Richmond. From Arlington, from the House of Delegates. Dave Davis from Alexandria, from the House of Delegates. Chris Jones from Suffolk. Chris is going to speak. We got Bobby Matheson from just right in these parts. Ralph Northam, who you're going to hear from in a minute. Cosgrove, and so you're going to hear, and you'll hear from John in a second as well. And then we're also going to hear from, and Bob Hall. Bob Hall from Northern Virginia, traveling down Northern Virginia legislators and Hampton Roads legislators really, there were votes from everywhere on this, but it was the two regional delegations that were the strongest, and so I want to thank them for coming. And then I want to also thank is Dr. Epps going to speak? And Dr. Epps right here. Give Dr. Epps a big round of applause. On behalf of the Medical Society. Well, folks are aware of this bill, and it's been a bill that's kind of been a long time coming. But maybe in legislative years, it's actually been a quick time coming because things tend to move slow, and particularly on something of this magnitude, on an issue that has this kind of importance, and particularly here in Virginia. Maybe it was actually relatively swift. In 2006, I signed an executive order banning smoking in state buildings and vehicles, and was interested to know what kind of reaction I would get, and was gratified to find that didn't get one complaint about it. In fact, state employees really liked it. And so that convinced me that maybe the time is right to go ahead and pursue. And there had been bills introduced previously on this topic of banning smoking in restaurants, but it seemed with no pushback at all on the state policy, hey, maybe the citizens of Virginia would support this in restaurants. We know from the statistics that if you work in a restaurant where smoking is allowed, you have double the risk of dying of lung cancer of the average American. We also know that we regulate restaurants' health in a very detailed way, and that's what we expect. And so it struck me as unusual that if we regulate restaurants to such a degree that we would not take care of such an obvious health concern. And so thus began the legislative effort to make this happen. In 2008, it was not successful, although a number of people I think were interested in the idea. Actually, there was a first effort in 2007 that got a little close. 2008, again, more folks picked up on it. And then this year, because of a great coalition of supporters, Democrat, Republican, all regions of the state, House and Senate, we now stand here signing a bill that will, in a very straightforward way, ban smoking in restaurants and bars. Now, there are two exceptions to the bill. Private clubs are not covered, so VFW halls, American Legions, etc. are not covered by this bill. And second, if a restaurant wants to allow its patrons to smoke, they can do so if they build a separately enclosed and separately ventilated room where smoking can take place, but the ventilation has to be to the outside, not back into the rest of the restaurant. The bill is actually pretty far-reaching because in Virginia, we don't distinguish between restaurants and bars. Any place that serves food, and bars are required to serve food. are called restaurants. And so this is a pretty far-reaching bill that will affect every bar and every restaurant in Virginia. And that, for Virginia, is a pretty big thing that we make that happen. I want to thank a number of people who are really instrumental in this. First, I've just got to start off with some folks on my own staff. My Secretary of Health and Human Resources, Marilyn Tapp. She has two deputy secretaries, one of whom, Ariana Khalid, is here. And I don't know that Heidi is here, but I know the whole team worked on it. We really appreciate it. And then from the governor's office, real tireless champions, Bill Gina Boyle. Gina, and then let me now really focus on the folks you're going to hear from next. This was a true legislative product of a lot of work. And let me talk about a number of the people who are involved you hear from. You know Senator Ralph Northam. Most of you know him because he represents this area, but maybe not all of you know, probably most of you do, that he's a pediatric neurologist at Children's Hospital King's Daughters, who has a very passionate focus on issues dealing with youth health. And so he has been an advocate on a whole series of issues dealing with the health of young people. But this has been a real passion of his. Ralph was the patron of the Senate bill. That is one of the two bills that's being signed today. The patron of the House bill that's being signed today is also from this area, John Cosgrove, who represents right here, Chesapeake, Virginia Beach, just all Chesapeake. And John was very instrumental in putting this bill in. And everybody had bills in that got massaged and shaken. And so as often happens in a legislative process, you got to have good patrons who carry their bills, but you also have to have good patrons who will allow their bills to be adjusted. But both Ralph and John did that and worked together to make sure that the two bills that we will sign are identical. Chris Jones, who's right behind me from Suffolk, used to be the mayor of Suffolk, is the chairman of the House and General Laws Committee. The committee where, you know, in the past, maybe, but in the past, the committees have been where these bills had kind of taken on a lot of water and sunk. But because of Chris's great leadership of his committee, this bill didn't sink, it sailed, and that's why we're here today. I'm very, very glad that Chris is here. And I introduced a number of other legislators who are here, but I want to just go back and mention one in particular because it's his last session, and that's Al Asper, who's here. Al has announced that he's stepping down from the legislature, represents Northern Virginia, been a legislator for a while, and this has been a real passion of his. And he was very active. I just want to acknowledge your service in the legislature, especially. There are also a couple of senators who are not here who are very active. Let me just mention them, especially because one, Fred Quayle, is from this area, representing also Chesapeake and Suffolk. Fred had a bill in that was one of the bills that was considered as these worked their way to a compromise. Senators Sasslaw, Whipple, and Howell as well. But it wasn't just legislators either. There were also advocacy groups. And again, I'll go back and say more to you and the Virginia Beach restaurants. You guys standing up and being such a key part of this was really wonderful. And so I'm very, very happy to host this, and you were such a passionate advocate of this. The Medical Society of Virginia, you're going to hear from Dr. Thomas, that's the president of the Medical Society, after the legislators have spoken. And Tom, the advocacy of the medical community for the specialties, and I know you have other members of the society here, and I know you've come a long way to be here, and we really, really appreciate your great work. So other organizations, the March of Dimes, the Virginia Pediatricians, AARP has representatives in attendance, Virginia Nurses Association, Family Physicians, ER Physicians, the Lung Association, David Mayo is here from the Lung Association, and then a whole lot of other folks. We have local governments weighing in, regular citizens made their views known in a very plain way, and again, it takes a lot of cooks to make something like this happen, so I'm very, very happy to be part of it, and now to introduce some of the legislators who are so key. What I'm going to do is I'll just ask to come up in this order of these legislators: Ralph Northam, John Cosgrove, Chris Jones, and then I was going to introduce Joe Bouchard here. Joe is not here. I was going to introduce him, so that means, Bobby, you're going to have to do it. So I'm going to have Ralph Northam first, and then John Cosgrove, Chris Jones, and Bobby to the scheme.
Thank you, Governor Kaine, and thank you, Laura, for opening up your restaurant for this great event, and thanks for all of you that are here. It's great to see the kids in the audience. This is your future, so glad to have you here. But You know, as a child neurologist, I joined the Senate 2 years ago with the hopes of advocating for better health in Virginia. And what better way to start than by decreasing our exposure to secondhand smoke. One of the things that one learns quickly in Richmond, that policy making is not a one-man show. It is a team effort. I learned that quickly over the last 2 years, and that team starts with some great leadership at the top, and I would certainly like to thank Governor Kaine and his staff for all the work that they have done. I would also like to thank the bipartisan approach that we had in the Senate and the House of Delegates, as Governor Kaine has mentioned. We could never have done this without the help of Delegate Cosgrove, Delegate Chris Jones, and all these other fine legislators that are behind me. And finally, I would like to thank you, the public, and the advocacy groups that have worked so hard on this. Again, it's been a team effort, and we could have never done this without you. I will tell you, as a physician, that the science is clear. There is no question about it. We know the ill effects of secondhand smoke. We know the increased incidence of cancer, of lung disease, of heart disease. We know the ailments that affect our children because of secondhand smoke. We know that there are over 1,000 deaths in Virginia each year from secondhand smoke, and we know that there are over $125 million of health care expenditures in this state because of secondhand smoke. This is a bill that we all work together on. The people spoke. I think you all can be proud that we now have a bill that will serve Virginia well. And I really look forward over the upcoming years to the positive effects this bill will have on health care expenditures and the overall health of Virginia. Thank you so much.
I've decided to interrupt the flow of speakers because there is one individual who's not here that I forgot to mention, and I need to mention as the speaker. Bill Howe, who played a very key role in making this happen. He's very excited about the bill and very excited we're able to do this, that he was not able to come. But I did want to acknowledge Bill Howe's strong leadership in this area and thank him for being such a part of this victory today. It's his victory as well. With that, I'll now have John Cosgrove come up and be followed by Chris Jones and Bob Evans.
Well, thank you, ladies and gentlemen. It is a pleasure to be here today, and I do have to thank the governor for working with us on this. I have to also reiterate that Speaker Bill Howe was a big part of this. You know, when Chris Jones took over as the chair of the General Laws Committee, and that's where we hear alcohol and tobacco, that was before the session even started. And Chris and I talked, and I said, Chris, I think it's time to move on this. Chris, hey, I'm a couple of steps ahead of you already. So we were already thinking along the same lines. I had voted against a smoking ban for the last several years because I felt this ought to be a market decision, and the private property rights entered a lot of what I felt. But when we run for election, we run in this representative form of government to bring the wishes of our constituents to Richmond. And in going door to door and talking to people at the grocery store and the post office, you know, even the most hardcore Republicans that I know in Chesapeake, and some of them would say, John, we love what you're doing up there, you know, keep it up, except when are you going to do something about smoking? So it's starting to sink in a little bit. And then we did a survey, and overwhelmingly the survey came back that they would like to see either an outright ban of smoking altogether or else some type of compromise bill in the 70% range. And so if I'm going to represent my constituents, I need to take their wishes to Richmond. And I think it's arrogant to stop and say, I know best, I'm going to do it my way. It takes time. It takes time to get to know what your constituents want. And as with all issues, momentum keeps going. And I think we worked together, we worked a lot this year in meetings with Senator Ralph Northam, the governor's office, the speaker, and Chris, to craft what I think is a pretty good bill. And I look forward to its signature. And certainly now we're going to have areas, if we go to a restaurant, you're not going to have to worry about that second smoke. If people are going to smoke, it's going to be behind the closed off area that's separately ventilated, and that's the right thing to do. So I appreciate you being here today, and thank you very much.
Good afternoon. Thank you for coming. I would echo what the governor has said. Many times in life you think you know what's going to happen when you get into something. There are many times when you say, how did that happen? Then there are other times when you say to yourself, if you give it an opportunity to succeed, then good things can happen. And I will tell you that when the Speaker asked or informed me that I was going to be Chairman of General Laws, I was very clear to him that I felt like we should have a fair hearing on the issue of smoking in restaurants. To the Speaker's credit, to the leadership of the House, they listened, and after having talked with the Governor and other members behind me, it was very apparent that the time was now to act. And I think the advocates who are here today have reassured us that we have done the right thing, because all of us have, we're 100 of the Virginia in the House and 140 in the Senate. Of course, the governor is really statewide. We were hearing what people wanted us to do. And we had people say, no, that's not enough, that's too much. But what I found in my almost 23 years of public service is that when you don't have everyone happy at the end of the day, you probably have a pretty good piece of legislation. And I think what has been crafted is that. And I have to give credit to the two gentlemen, the Speaker and the Governor, for making that happen. I want to thank you for coming today, and I look forward to the ink going on the paper. And then when 12/1 comes, we can all go into a restaurant and have to say if you like smoking or non-smoking.
Good afternoon, and I echo the comments of everybody before me, but I particularly want to thank Laura. For those of you that don't know, Laura has sort of taken this on. Those in the local restaurant industry here know how passionate Laura has been about this bill, and she is so deserving of the grassroots support that helped get us here today with the Governor's signed this bill. So please let's give Laura a round. When candidate Obama was here in Virginia Beach back a number of months ago, Laura had the pleasure of introducing the green-friendly restaurant here at Croc's and actually serving President Obama on eco-friendly takeout ware. So she is passionate. They hold a farmer's market here in the off-season. It really is so much about health. And we know from the support also of the grassroots, well, even the statewide tourism and travel industry, which is, in Virginia Beach, we know it is the golden goose, and it is our bread and butter here. So, for years, of course, I've only been up here 2 years, but for years there was always a concern of whether it hurts the industry, whether it hurts restaurants, whether it hurts travel and tourism. I think we will show that it will be certainly helpful, and it will be great in marketing concepts. But I say a few words. Joe Bouchard wasn't able to make it. I'm happy to be here, and I thank you all for your wonderful support. Thank you.
We now bring one other speaker up, and then we'll open it up for a couple of questions. So Dr. Thomas Epps. Dr. Epps is the President of the Medical Society of Virginia, and I can't overestimate the degree to which the help of the society and the other physician groups made this event possible. So Dr. Epps, it's a treat to have you with us today.
As representing the over 9,000 members of the Medical Society of Virginia, and actually all the physicians of the state, it is an honor to be here to witness this historic event. It is a great day for the health of the citizens of the Commonwealth, knowing that they're going to be able to breathe a little bit easier when they go into a restaurant. Last week I went to a restaurant, and they asked me smoking or non-smoking. And I looked at her and said, hey, December 1st, you're not going to ask me that anymore. And you know what? The look in that waitress's eye told me this was the right thing to do. She smiled and said, you're right. We did the right thing. As a family physician, I treat patients who have conditions that are caused by nothing. They just happen. I also have patients that are ill due to preventable causes, and secondhand smoke is one of those great victims. Childhood illnesses such as respiratory infections, asthma, learning disabilities, related to the secondhand smoke issue, and 1,700 citizens a year in the Commonwealth die secondary to their secondhand exposures. I've had to tell people that they caught their lung cancer because of the spouse that preceded them with their lung cancer. Really sad thing. This legislation will help us reduce those numbers of preventable deaths. That is what physicians should always be in the business of doing. The Medical Society and its 9,000 physicians applaud the leadership, perseverance, and courage that our governor and the legislators have shown over the past several years. I'm also proud that this was not just the Medical Society driving this. We have lots of people in the coalition, in particular the family physicians with the Virginia Academy, the American Academy of Pediatrics, their division, the Virginia College of Emergency Physicians, and also the Psychiatric Society of Virginia, who all actively supported and worked the halls of the Assembly to make sure our message got out. It's taken several years and the involvement of many to reach this point. Through compromise, collaboration, and patience, we have made one giant step forward. Thank you.
Well, let's see. I think we'll, why don't we sign the bill first?
So the way we do these bill signings is, it's endlessly fascinating. Watch me sign it. I get these special pins with my signature on them, and I have 2 pins and 2 bills. One for Senator Northam's bill, Senate 1105, and the other for House Bill 723, which is Delegate Cosgrove. And the way we like to do this is, for the legislators, is first everyone look on with fascination as I sign. And then everyone look up and smile. We're going to repeat. This is Delegate Cosgrove. So they're both identical. And, all right, as of December 1, we got a new law, folks. So let me open it up and see if there's questions. We'll take a couple from here, and then I think folks might go around and visit. I'm not going to catch somebody individually. But are there questions that you want to ask me? Everybody wants to get to the buffet. Well, listen, let me thank Laura again. Legislators will stay here if you want to talk to them, I know, and especially for those who drove down from Northern Virginia, and Dr. Epps who came from far, and others who did. We appreciate your help. This is a big day for public health, and you all made it happen. Thanks very much.